Let me hit you with a jaw-dropping stat, no pun intended here. Gum disease affects nearly 75% of adults. Most of them don't even know it. And untreated, it can lead to some serious problems for your overall health. Thank goodness this guy's here. Dr. Dwayne Keller joins us this morning to talk about the dangers of gum disease and what he can do to help. This is actually something he designed, produced, developed himself. Very nice to meet you this morning, sir.
Thank you, Matt.
So what is gum disease, first of all?
Gum disease is an infection. It's a bacterial infection. The bacteria get under the gum tissue. They become more dangerous, more virulent as the pockets get deeper. Unfortunately, they don't stay there. We know now, and you almost can't pick up a magazine now without hearing how they're related to heart disease and strokes and et cetera. But what we're able to do now is give the patients a medical device. This is what it looks like. It's called a perio tray. It's custom formed to fit the patient. What we do is we have the patients put a very small amount of hydrogen peroxide gel in the tray, which is the body's natural antimicrobial. We make it ourselves, so it's not a foreign body. When the patients put the trays on, wear it like when they shower or bathe.
That's
to kill the bacteria.
So 10 minutes, 15 minutes.
10 to 15 minutes is usually enough to keep it under control.
No kidding. And I mean, long term, this is going to keep it under wraps?
The idea is keep the environment one that is conducive to health, not one that's conducive to disease.
There's a lot of people watching right now who think, you know, not everybody brushes and flosses as well as I do. I'm probably in the clear. But then I see that 75% of adults, far more than half of us in adulthood, are going to face this at one point or another. So is brushing and flossing just not enough?
For some people it is, Matt, it can be, but for the vast majority of people, brushing and flossing just don't get under the gum tissue far enough to keep the bacterial community under control. And this is just so easy, simple, safe, reliable. And the only side effect is it whitens your teeth.
Oh, bummer.
Yeah, sorry
I'm not interested anymore. Forget it. I like the story of where this came from, too. Your mom dealt with this and had surgery, which for a long, long time was not an option. It was basically the option. And tell me about her experience and what she came back to you and said.
My mom had one section of surgery done. And we got what we thought were good results at that time, which were comparable to what we used to get. But when I said, you know, Mom, it's time to do the second surgery, because she needed 4 of them, she looked up with her beautiful little blue eyes and said, it's just not going to happen.
Ouch, because surgery number 1, not a great experience.
And anytime you drink something cold and food stuck between her teeth, so she said, can you find a different way? And this is the result of that.
This is fairly new, so tell me about the cost. Is this going to be affordable for folks?
It is affordable. Actually, there is now going to be an ADA code that starts January of 2014. So even the trays will have an ADA code.
Meaning like for insurance billing purposes?
Right. So people should be able to maximize their insurance benefits with the method. We still do cleaning. We still do home care. We still tell people to brush and floss. You just wear these first, and then the brushing and flossing is that much more effective.
I love it. 10 minutes a day sounds like it's hands down better than surgery any day of the week. Mom's words must have stuck with Dr. Keller because he worked on this for more than 10 years to perfect it. It was a labor of love. Thank you very much for coming in and telling us about it. We appreciate it. If you'd like to learn more about the Perio Protect method, you can call Dr. Keller 314-638-4190. or check him out online, drdwaynekeller.com.